I have an overbite and got braces to fix it. Got 2 premolars removed from the top and just 1 from the bottom. Will my smile look misaligned after the treatment is over because I only got 1 premolar extracted from the bottom? So this is something that happens periodically. So depending on how your teeth grew in, how the whole process unfolded, you may have some asymmetry, meaning that the teeth weren't fully aligned with your face. So a lot of times this will happen if you have a baby tooth lost early. The teeth will shift one direction or the other, and based on how those teeth grew in, if we need to move things around to get the midlines onto the face, we may only remove a premolar on one side or the other. So again, that happens. It's fairly common, and usually it's not something to be overly concerned about. So in your case, having 2 premolars removed on the top and 1 on the bottom, I would say it's probably going to end up great. I obviously can't see your teeth personally, but that is something that we will take into consideration. Not everybody's treated exactly the same. Sometimes we'll have 2, 3, or 4 teeth out. And all that is taken into account, like what does this patient present with? Where do we want the teeth when we're done? And how are we going to get there? And so, again, ask your doctor specifically. They'd probably love to explain this and hopefully get you a little bit more information about your case specifically. Next question. Does it hurt during and after braces installation? So most of the time, anytime you're in the office, nothing really hurts. When getting braces on, when getting them adjusted, nothing is really too painful. You don't have to get any shots. There's no numbing. There's nothing really invasive. It's mostly when you get your braces on, they dry the teeth off and glue braces on. So you do have to have some contraptions and gadgets to kind of keep your cheeks and lips away from your teeth. Those aren't the most comfortable things, but they're definitely not too painful. We do braces on kids as young as 7. They do fine. So again, I wouldn't worry too much about getting braces on. After your teeth start moving, you definitely will get some soreness. So I use the example again, if you go out and run 3 miles and you've never run before, your legs are going to be sore the next day. But as you continue running, that soreness goes away and your body adapts. It's the same thing with your teeth. That first week is tough with braces. Your teeth will hurt, they will be sore. You want to eat soft foods. After about a week, you're usually through the worst of it, and it's really not too bad. So again, a lot of people get braces. Everybody goes through that first week, but everybody gets through it, and almost everyone would say they would do it again in order to get the result from the smile. So it's worth it, and definitely stick with it if you have any soreness during that first week.